Good afternoon, everyone. I'm Iskandar Azwa, an associate professor at University Malaya in Kuala Lumpur, Malaysia. I'm very pleased to meet all of you and welcome you to session 2 of the You Matter, Inspiring a Client-Centered HIV Response in the Philippines and Southeast Asia, IS Educational Event and Love Yourself Symposium. Now, this virtual event aims to discuss the challenges and the recent updates, particularly around HIV response in Southeast Asia. Over the next 2 days, during today and tomorrow, 4 main topics will be covered during this meeting. PrEP and PEP interventions, stigma around HIV, PrEP and U equals to U, testing and treatment as prevention in Southeast Asia, self-testing and sharing of best practices across the region. This particular session, session 2, will specifically revolve around ensuring people's understanding and unity against HIV. It is going to be done in sort of a talk show format that will provide insights on stigma around HIV, PrEP, and U equals to U. So before we start with our speaker lineup, we need to go through some housekeeping rules. So firstly, all participants are currently muted, but you can ask your question in the questions and comments box right under this window. I invite you all now to please introduce yourselves by typing in the chat or interactive box that is right underneath the screen. And you will see that your message shows in the interactive box to the right of the screen. Please type your first name, your last name, the organization you work for, and the country you are from. Please use this opportunity to connect and get to know everyone. Please send questions through during our discussion so that we can address any questions you might have that you'd like to ask any of the speakers. We are also pleased to announce that if you participate in our feedback survey at the end of this meeting, you can request a free 1-year IS membership. So please participate in the feedback survey. All meeting participants will receive an email about this after the very last session of the symposium. Also, please note that this meeting is also CPD accredited. All you have to do is attend all 4 sessions, and we will give you instructions on how to claim your CPD unit accreditation. After the 2-day event, an official communication will be sent to your email. Again, you have to complete all 4 sessions to complete your CPD units. So without further ado, let's now meet our panel as they amplify their voices to address stigma around HIV, PrEP, and U equals to U. Our first panelist is Kritima Gemma Samitpol from the Tangerine Clinic in Thailand. Do you want us to give us a bit of a wave, Gemma?
Hi, everyone. Hi.
Thank you. Our second panelist is Dr. Ben Beventon from the Kirby Institute, University of New South Wales in Sydney, Australia.
Hello, everyone. Nice to see you all.
And our third speaker is Bik Arthur Maslian from the Family Planning Organization of the Philippines, the Baguio City chapter.
Hi, y'all.
Our fourth panelist is Ayu Oktariani. Ayu is an activist in the field of HIV and AIDS from Indonesia.
Hi, everyone.
Our fifth panelist works closely with Love Yourself and is an active PrEP user. Please welcome Marvin Natural.
Hi.
Okay, Marvin's there. And our next exciting panelist is a global ambassador who's known for her winning answer about HIV awareness in the Miss Universe stage. Let's all welcome Pia Wurtzbach, Miss Universe 2015 from the Philippines and UNAIDS Goodwill Ambassador for Asia and the Pacific.
Hello, good afternoon. Hello, everyone.
And lastly, our seventh panelist is Dr. Louis Ocampo, Country Director for the Philippines at UNAIDS.
Hello, everyone. Happy to be here.
Thanks again. Big thank you to all the panelists once again for joining us in this session. So this segment of the symposium will really enable us to learn right from the voices of the community, which is essentially what we want, and particularly those that are moving, the community movers and experts. We will be opening the floor for questions. So whilst we wait for questions to come through, I'm going to just start asking some questions, if that's okay. So let's start with Gemma, if that's okay. So this is a question directed towards Gemma. So this is very interactive. So please sort of chat with each other. Let's not just make it a very, very formalized session. It should be very, very informal. After all, we have Miss Universe here. So for Gemma specifically, the Tangerine Clinic has done an amazing work with increasing visibility and destigmatization of the transgender community in the public domain. Can you start by sharing with us some of the work that has been done and the positive benefits that are being reaped in your region that can be lessons learned for us around the region?
Okay, thank you so much, Dr. Iskandar, and hi everyone from Bangkok, Thailand once again. It's so nice to be here today. Just to answer a question of Dr. Iskandar, I have to take you back 5 years ago when we first started the clinic in Bangkok. We actually do not position ourselves as a HIV clinic, even if we work on HIV and STI, but we position ourselves as a transgender health clinic. So that leaves the big options to the people that they can come to see us for any reason at all. It doesn't have to be just HIV and STI. And when they come to see us, of course, we prioritize their needs as the first thing that we want to focus. But then we can always, integrate and offer HIV and STI as part of the services that we have for them. And this model has been proven to be working in our country and in our setting. And if we look at the numbers now, we have been serving more than 4,000 trans people in Thailand. I mean, especially in Bangkok. And then we have the more than 90% rate of HIV testing with us. And that includes the first-time tester as well. So that's been something that we've been doing. And I hope that maybe this model can be scaled up in other countries in the region as well. And I know that Victoria, by LoveYourself in the Philippines, are doing a very great job on this as well. And I'm so happy to see quite a few videos early on the first session. And the other thing that we did was last year, again, because we work specifically to the trans women. And last year we did a program called the PrEP in the City, which we were targeting the transgender women, especially in Bangkok City, in the area, because we know that lots of trans women have actually never heard or never have any idea about PrEP at all. And comparing to the campaigns that we have seen, quite a few from the men who have sex with men on the PrEP, they're quite a few already, but we never seen anything for the trans women. So this campaign was designed to raise the awareness among the trans women about the PrEP, and also to normalize the use of PrEP among the people, and also to empower the trans women to take PrEP and to take control of their health. And together with the techniques that we do during the PrEP counseling called the PrEP gain framing counseling, so that we can actually give all the information and motivate the trans women to actually have the informed information that they can make a decision and take control of their health. And after we launched this campaign, we found that there has been a significant rising numbers of the new PrEP uptake in our clinic and in the CBOs that we work with as well. So basically, whatever we do at the clinic, we try to normalize it. And we try to make sure that people get to us with no limited. I mean, like, it doesn't have to be just HIV. That's our main principle. Anyway, even if we've been working for 5 years now, and then we have seen a big expectations that we have to, some of them somehow we haven't been able to do so. I just want to say something about the U equals U, that actually it is great. U equals U is great, but then again, you see, for the counselor like myself or the community worker that have to work with the clients directly, I think U equals U is good in the way that we can actually work with the clients who found to be HIV positive to motivate them to actually reach that goal of that U equals U. But then again, here comes the big challenge related to U equals U is the index testing. Why is it a big problem, especially for the trans community? Because, you know, living in a country like in Thailand, where we don't have gender recognition law, where we don't have equal marriage, and somehow in some parts of the country, we still see trans people being trans is wrong. And also, you know, that poses the stigma and discrimination onto the partner of trans people as well. So it's been very, very hard for us to reach out to the trans people partner because they don't want to come out. They don't want to be seen. They don't want to be noticed or known that they are in a relationship with the trans people, even if they actually live together. So when it comes to index testing, that's still a big gap for us. So let's say that, I mean, U equals U is quite hard enough in the way that because in Thailand, I'm not sure about the other countries in the region. In Thailand, we don't seem to have like a clear policy coming from the government on what should we do, what are the clear policy, what's the guideline. So all the works are actually down to the counselor to actually give the information and education and all the things that, you know, we need to prepare and to build up the understanding of the client to actually, you know, understand it and try to reach the goal. If we have, you know, a clear action plan or procedures or guidelines from the government sector, that would be very, very helpful, at least to raise the awareness of the people in the public sector. And about the index testing, as I have mentioned earlier on our issues, that it has been very hard for us. And I hope that if there's any policymakers that might be watching us now, we'll be paying attention on this, and then we can help working together on this to, you know, improve the quality of life of trans people and their partners as well, and you know, eventually to end HIV together. That's me. Thank you.
Thanks very much, Gemma. I think you're one step ahead of most of us. I mean, your PrEP in the City campaign is certainly, I think it's certainly something that the region looks very highly upon in trying to get the transgender women in particular to come forward and get PrEP. But you raised interesting points about index testing, presumably, and concerns around being associated with the trans community in terms of partners, which personally I hadn't even you know, really thought about. There could be potentially problems around that. Maybe I can throw it out to the panel. Does anybody have any potential solutions or experience in dealing with the stigma of index partners within the trans community coming forward, and how we could potentially, you know, sort of solve that? Maybe could I ask any volunteers, or could I? Otherwise, I'd ask someone.
Dr. Iskandar, sorry, just to add to what you just said, I mean, like when I'm talking about the index testing among trans people, I mean, that can include with other, you know, population of the LGBT people, yeah, where being them are seen as being wrong under some specific culture, law, or even religion. Thank you.
All right, okay. All right. Does anybody have any potential solutions to that? What about Ben? Do you want to throw your 5 cents worth on that?
Yeah, I don't know that I have solutions for this, but I think this is definitely a global problem. So this group of men who have sex with transgender women is really hidden in every country. Even countries that you would expect to be sort of more progressive on these issues, it's really, really, really hard to find these men. And I think the main way to access them for different interventions, but also for research, would really be through the trans women themselves and trying to build trust with those trans women, and then hopefully getting some peer leaders within those trans women to build some trust with those partners and kind of get the word out about various interventions. Now, one of the big problems with this group, and I'm sure Gemma knows all about this, is that unlike the trans women themselves and unlike gay men, the men who often see themselves as heterosexual who are having sex with trans women don't often know each other. There's not really a sort of network or community of these people out there. So it's not like you can just reach one of them and then hope that they're going to go and reach all of their friends with your message or with your intervention. It doesn't really work like that. It's a very sort of atomized network of people that are all linked together via the trans women, not via each other. So I really think in this space, the trans women are the key. Thank you.
Okay, thank you very much. Do you have any experience of doing that kind of work as well in Australia, Ben?
No, I have to say this is an area where I am sure Thailand is far ahead of us, like I think it is in many areas in the region.
Okay, great. Okay. Thanks very much. Now, since we're on you, Ben, at the moment, I've got a question for you, and feel free, please, panelists, please ask each other questions. Now, this is diverting a bit from stigma, but only because it's very topical, and I thought we'd just break things up a bit. The CDC has recently released a draft of revised clinical guidelines for HIV PrEP, and there's a new section on prescribing injectables, so cabotegravir. What kind of discussions are happening within the region to access these, if any? And should we be more excited? And where do you potentially see a role for these? In particular, and how can we fit stigma reduction in some of these questions that I'm asking?
Yeah, thanks, Iskandar. We should definitely be excited about these, not just cabotegravir itself, but also the various new PrEP options that are going to be coming down the pipeline over the next 5 to 10 years. There's more than just cabotegravir that's on the way. In terms of discussions that are happening at this point in our region, I think at this point, the focus is still mainly on acceptability research, trying to sort of find out what people think and feel about these various options, including oral PrEP. But trying to sort of find out how many more PrEP users could we get if we offer more things than just oral PrEP. So there is an exciting project that's happening being led by UNAIDS in Bangkok. I'm part of this project, and so is many people around the region, where we're going to be doing a multi-country survey of men who have sex with men, and then a separate survey for transgender women, which will really go into people's attitudes and preferences around these new PrEP options. But I do have to say there are going to be barriers in implementing cabotegravir, but also the new PrEP options all across the world, but especially in Asia. As we all know, I think on this call, Asia is really lagging behind in PrEP as an overall region. It's not because people at risk of HIV don't want it, it's because mainly they can't access it. There's really only 2 countries in the region that have widespread programs for oral PrEP, and I really don't see how this is going to be very different for cabotegravir. So again, I don't think the answer necessarily in Asia is getting really, it is to be excited about the new products, but not to put all our faith in these new products, but we really need to focus on the here and now and ramp up oral PrEP access right now so that when these new products become available in the future, we have some systems already set up and we have a group of people who are already using PrEP who then will be able to kind of roll out new forms of technologies as they arrive. I think that's really important. I mean, we have a product that's basically 100% effective, that's in the control of the HIV negative person, and yet very few people at risk of HIV in Asia can actually access it. Imagine if we had a COVID-19 vaccine that was 100% effective and then no one bothered to roll it out. No one would do that. I think partly, and this is where stigma comes in, I think that a lot of countries in Asia view the populations that we're concerned about here on this call as not a particular priority. And I think that's one of the reasons why PrEP is not more broadly rolled out. However, having said all that, I do think there is a role, very important role for cabotegravir and the new products. Choice is going to be really important as we move forward. So just like with the oral contraceptive pill in the 60s, it started with one product and now there's an explosion of options that are available for women to prevent pregnancy. And the same thing is going to happen with PrEP. So what we need to avoid is this really long delay that happened between the evidence and the implementation that happened with oral PrEP, that's still happening with oral PrEP, frankly, in Asia. We need to avoid that. We need to get this happening much more quickly. And to do that, I think we need to get policymakers and funders on board to see how important this is. Treatment as prevention is really, really important, but I think it's been shown repeatedly around the world that treatment as prevention is not enough. to be able to bend the curve in the HIV epidemic in key populations, we are going to have to see PrEP at scale, and we need to ramp that up in all its various forms as they become available. Thank you.
Thanks very much, Ben. You know, I feel your frustration. I can understand it. I feel it. We have the same frustrations, and I've voiced it at a couple of meetings with respect to PrEP rollout across the region. But something more close to home, you know, in terms of PrEP rollout in Malaysia. And despite a fairly successful demonstration project, moving on to the next step of scale up at a larger scale has been very much impeded. And largely because I feel anyways, and I think that it's shared across the board, although people don't really talk about it, is PrEP related stigma across, in particular in a very conservative society. The policymakers are very conservative minded. And I think despite what we could potentially learn, as you've said, from, you know, the combined pill, for example, and lessons learned from them to apply to the PrEP rollout, I still think we're repeating the same processes again and again. And so therefore it comes to this question once again, you know, is PrEP related stigma ultimately about how policymakers and healthcare providers wanting to morally dictate how persons at risk of HIV infection should have sex? And I'm sure you don't agree with this, but maybe you could comment on this. And how would you address this as part of the problem in this being rolled out at larger scale across the region?
Yeah, I do agree that that's a major problem. And I think that's a problem in many countries. It's about homophobia, it's about transphobia, it's about biphobia, but it's also about a general sex negativity. This idea that everybody should be living a particular kind of sexual life and anything else that fits outside of that is morally wrong, and we just don't want to know about it. So I think a lot of the barriers around PrEP, not just in Asia, but around the world, are to do with this sex negativity, this kind of view that if we just don't promote ways for people to be able to have sex free from fear, then somehow people just won't have sex. And we all know that's just ridiculous. People will still have sex, but if you withhold a tool like PrEP, or if you withhold information about U equals U, then all it's going to mean is that people put themselves at risk when they have sex. So PrEP enables people to have sex free from fear for the first time since, you know, the beginning of the HIV epidemic. And I think people find that quite scary. Some conservative people do. So in terms of the impact that this had, we've just recently run a survey in 5 countries in Asia that had over 15,000 respondents, which were men who have sex with men. And we actually found quite high rates of people saying, I actually avoid going to get my healthcare because I'm afraid of stigma at the healthcare setting. That's really concerning. We don't want to see that happen. And we also had about 10% of people, men across these different countries, saying they had actually had negative experiences in the services that they went to, which is also quite bad. So I think we need a couple of things to address this. There's kind of a generalized model, which would be finding ways to do training with people in healthcare settings about at least being non-judgmental at a very basic level. Like, it'd be better if they could actually be sex positive, but at the very least, they just need to be non-judgmental. I think that needs to be done in lots of different healthcare settings. But along with that really generalized way, I think this really highlights some of the stuff that Gemma was saying before about Tangerine, but also more broadly, it highlights the hugely important role that key population-led services can and will have in Asia. I think more than many places around the world, Asia just needs these services, like LoveYourself, like the various clinics in Bangkok and many other countries. These are the places that people from these stigmatized minorities can go and know that they're not going to be judged for their sex lives or their drug use or anything else that they might be doing. And I think they're going to play an increasingly important role. So we need to see greater funding for these services and more support for them. Thank you.
Absolutely. Thank you very much, Ben. I'll come back to key population-led services, but if I could just go around the rest of the panel first. So now this is a question for Vic, and probably a timely question in the sense that we're talking about PrEP access and stigma around PrEP and sex. So really, because you should represent the youth, do you feel as a society, particularly amongst the youth and particularly amongst the region that we live in, so Southeast Asia, are we given the platform? And do we feel safe and comfortable enough about talking about sex and sexuality in the public domain?
Thank you for that question, Iskandar. So first of all, the Philippines are just like other nations in the Asia. So Philippines has a strong cultural and religious background. So we are highly conservative, really up to this date. So sex and sexuality is still a taboo on most countries, and of course, especially in our country and most parts of our country, it's still a taboo. So for young people, we remain, I think, restricted by our culture, our religion, and as another thing is our education. So people in the Philippines, when people hear the word sex, sexuality education, so they link that to promoting promiscuity, which should be not the case. And another thing is that people are really not aware that sexuality is multifaceted or it is multi-dimensional. So when we talk about sexuality, there should be sex, gender identities, sexual orientation, pleasure, intimacy, or rights. But most people cannot or don't understand that yet here in the Philippines. So as a result, the youth cannot really open up sex and sexuality freely. So there's still stigma and discrimination. So to be fair, I think we are given the platform to feel safe and comfortable about talking about sex and sexuality in public domain. But I think, or I firmly believe that it is still limited. So it is not talked about fully due to our culture and religion. So as the youth, it is a challenge for us to normalize these conversations, to increase the level of awareness among the youth and other people in the communities. So another thing that I can see is that one reason for this is that there is a low level of investment on sexual health here in our country. Okay.
Great, thank you so much for that. Do you still think that in the 21st century, this should be a problem? The younger generations, are really more open-minded and are more socially connected through digital platforms. Surely there's a way around the youth to sort of bring this into more visibility. And what do you think?
Actually, I think it's a big problem. So there's still hope. It's still good that when I scroll my Facebook feed every day, I see people in my generation sharing about topics about sexual and reproductive health rights. But they are actually aware, but it stops there. They're aware and there's nothing to do. They don't know what to do after. So I think that's what we do as an organization. We educate them to reduce the stigma. So around these topics on sexual education or comprehensive sexuality education. So for FPOP, we try to educate them. We don't just focus on HIV. So our entry point for talking about HIV is the other problems that the youth or the youth face. So we start with the adolescent development. We start with puberty, and then we go to teenage pregnancies and sexual and gender-based violence before we talk about HIV and AIDS. So for them to understand that these things are interconnected and for them to be more accepting of this information.
Okay. Can you just, because from somebody who doesn't know very much about the issues around, let's say, teenage pregnancy in the Philippines, is that a big problem there in the Philippines and presumably access to contraception?
Yes, the cases of teenage pregnancy is still increasing here in our country. So for the last survey, for the young adult fertility and sexuality survey, they say that 1 out of 3 young people in the Philippines is engaged in premarital sex. So most of them really don't use protection. So that's a cause of teenage or pregnancies. So with teenage pregnancy, we see it as a multidimensional issue, and it has a lot of effects. So when a youth gets pregnant, there isn't a chance that there will be maternal and child mortality. And of course, since they did not use protection, there will be an increasing risk of sexually transmitted infections. So and for up to this date, there is still the number is still increasing.
Okay. Thanks very much. Okay, so if we could move on next to Ayu, so Indonesia. Why do you think, as a person who's openly living with HIV, it's so important to get the message of U equals to you out?
Yeah, thank you, Iskandar. So for me, in my opinion, U equals U is very important message to eliminate the stigma and discrimination, so people will not afraid anymore with us, you know, to be friend with us, work with us, even you know, when you want to have an intimate relationship with us, such as marriage. Yeah, it helped me personally normalize my life and back to the bigger community, not only in HIV circle. So that's the main issue that I get since the beginning. I heard of the concept. Wow, this is amazing. But you know, after I learned more about the women issue specifically, there's, you know, there's a difference of using the concept of U and U, U equals U, related to the PMTCT program. That if women living with HIV want to do the pregnancy plan, you know, we cannot use the U and U because this concept will only protect you from HIV. You know, it not protect you from the unwanted pregnancy or STI. So you still can get pregnant and get STI, even you already undetectable from HIV. So when the women living with HIV is not ready yet to pregnant, I think very wise if they still to use condom, even the viral load suppression is still undetectable. So that's why my organization, the National Network of Women Living with HIV, is right now working very hard for elimination the violence against women. That mostly the cases comes from the intimate partner. But again, the UNU concept is very important, back again, to eliminate the stigma and discrimination. But since they cannot prevent and protect the women living with HIV if we have unwanted pregnancy, then we get violence from our partners. So U equals U is also very situational for women living with HIV. I think that's my opinion.
Yeah. I think sometimes we tend to forget it's just very focused on HIV. It doesn't mean to extend beyond HIV, but sometimes people may misunderstand that and think it applies to all sorts of consequences of unprotected sex, as you clearly say, like unwanted pregnancies and STIs. Yet, you know, this message of U equals to you, you know, as a healthcare provider, for me, it's very easy to try and get the message out to somebody who sees a considerable number of HIV positive patients in the clinic. And it's also very emotional for some patients when you tell them what the real meaning behind U equals to you. But yet at the same time, I think we struggle with other healthcare providers. We struggle with policymakers in trying to get that message out, especially within the region. And we know of the not too long ago backlashes in Thailand that occurred with healthcare providers trying to get the message out that U equals to you. So my question here is, should we be targeting the general public? Should we be targeting people living with HIV? Should we be targeting doctors, more importantly? Or should we just be targeting everybody? Because some people do not feel that HIV is a part of their lives, and it only applies to people living with HIV. What do you think?
Yeah, well, right here in Indonesia, I'm trying to you know, make the issue is bigger, not only in you know, people living with HIV perspective, but like we already heard from Thailand that the transgender people have also concern on some issue, and back in my country that also have difficulties with the, you know, the country with the religious concept. So I think we have to change our perspective into not only, you know, make the I don't know how to express it, make the gap and put every community in the box, even they have specific issue, like as I mentioned about the women living with HIV and you and equal you, but we have to see the bigger picture. So let's say if we talk about the healthcare providers who still, they never agree with anything, I believe they will only follow the Ministry of Health in the country, the bigger power, the higher power who have decision. But I think it's very important for us to make a lot of discussion like this for to see how the real situation with each community, and how the HIV is the frame, but you should see deeper than that. I hope it's answered.
Yeah, no, absolutely. I have a lot of questions around U equals U, so I will come back to you more specifically around whether, this issue about some people needing to use condoms and effective messaging. So I will come back to you, okay? But I think I want to go to the next speaker for a little while, if I may. So this one is for Maven next. Now, I always find some of the more interesting feedbacks always come from the PrEP users, certainly from a personal perspective of how PrEP has potentially changed people's comfort level with having sex and having that intimacy between another person. So just moving to you, Maven, if I could ask, what are some of the, as a PrEP user, what are some of the collateral benefits of PrEP that you have personally experienced? So positive benefits beyond just HIV prevention.
Thank you very much, Iskandar. It's important that we recognize that the benefits from taking PrEP is not just from prevention against HIV per se. So there are a lot more benefits that comes from taking PrEP aside from that. And personally, I can think of 4 benefits that I have personally experienced. The first one is pleasure. Second one is there's a lot less anxiety and guilt surrounding sex. And then the third is control. And lastly, sexual health in general. So let me go first to the first point, which is pleasure. Probably the major reason why people choose to have condomless or unprotected sex is because condomless sex is a lot more pleasurable. So there is an option to, depending on the risk that I'm willing to take and the partner that I'm with, to just to use just PrEP as my protection. That's why I'm careful with choosing the words condomless as opposed to unprotected, because when I'm on PrEP, I am still protected. I'm just choosing the type of protection that I want to use at that moment. So that first is pleasure.
Maven, can I just ask you to keep the microphone close to you, please?
Is it better now?
Much better, yeah, thanks.
The next one is less anxiety and guilt. This is something that has plagued a lot of gay men or men who have sex with men. There's always that anxiety and guilt surrounding sex. There's before doing it, during the act itself, and after it. There's always that fear that have I contracted AIDS, or have I contracted HIV during that encounter? Will I be passing whatever I got to another person? And that is somehow diminished, not completely eradicated, but significantly diminished. And it has made the acts of intimacy a lot more pleasurable, a lot more enjoyable. Third one is control. As I've mentioned earlier, depending on the sexual act or the sexual partner, at that point, I can choose the type of protection that I want at that moment. So, for example, I want to have PrEP and condom at the same time, or just condoms, or if I'm not very active, I will just stop PrEP at that time, and then just continue when I'm a little bit more active at that time. The third one, the last one is sexual health. For me, because I'm taking PrEP, that for me is already a bonus that I'm already taking care of my sexual health. That gives me a sort of a cue that, oh, I'm running out of prep at this time. Maybe I should visit my provider. So that becomes a regular thing, and that I'm very conscious about my sexual health, and that moves on to not just sexual health, but also in the general health, other facets of my health that I'm carefully monitoring as well.
So thanks very much, Marvin. I think you sort of summarized, you know, the benefits of using PrEP in terms of pleasure, anxiety, choice, and being responsible for one's sexual health. Policymakers may not necessarily see that, of course. Certainly looking at taking PrEP as being responsible for one's sexual health. And that's a thing that I think those of us who work in HIV and HIV treatment and prevention struggle with getting people to change their mindset as well around that. Rather than a negative perception of being irresponsible of one's sexual health, is actually a positive responsibility. And it just takes time, I think, a long time to work with policymakers and get them to see it from that point of view. And I think it's also, as you clearly put it, it's changed how people have sex. People who have been so fearful of having unprotected sex from the days of when HIV emerged in the 1980s, a significant impact not only on a personal experience of pleasure, but also of being able to relax. I think after a long time of having to always think about condoms. Once again, I'll come back to you because there are more questions on that I want to ask, but if I may move on to Pia, please. So Love Yourself wouldn't be Love Yourself without a beauty pageant winner. So beauty pageants are a huge deal in Philippines, and that's what Love Yourself capitalized that to the maximum. Can you please share with us how you've come to work with Love Yourself and how you're leveraging on your current celebrity status in undertaking your past and future advocacy, particularly around your work around HIV stigma and U equals to U?
Okay, thank you. Thank you for that. So yes, you are right. Beauty pageants are big here in the Philippines, and we want to take advantage of that. So the way I started, I'll tell you, the way I started with Love Yourself was I tried joining pageants again and again. So then the thing was, the thing in the Philippines is you have to win in your country first before you go international. So I competed here in the Philippines as Miss Philippines, and part of the work that we do is that they invite us to different organizations and different advocacies, different charities to educate us, and so that we also find the advocacy that's really close to our heart. So sometimes we're working with Operation Smile, sometimes I'm at a hospital, sometimes I'm meeting with kids, sometimes I'm meeting with women, just different organizations. So one time I remember, this was before I became Miss Universe, I was invited to visit people who are living with HIV. And that was the first time I was invited to an event like that. And I noticed that there were I noticed the tone in the room. It kind of changed. And then I felt that there was a little hesitation from the queens, beauty queens, there was hesitations from beauty queens to attend. Well, we didn't say no, but there was hesitation because of a lack of knowledge. And so we kept asking questions like, okay, how little do I really know about HIV and AIDS? And then I realized that how am I going to be an effective spokesperson and an effective beauty queen if I don't know much about this? If I get invited and then the people around me are hesitant, then that means there's something wrong. How can I do this job if I don't know anything about what I'm doing? So then I became more curious. So then I tried to really find out. And then I learned that when you hug somebody, you don't get HIV from that. When you share a spoon, you don't get HIV from that. When you share a meal, when you hug somebody, that's not how you get HIV. But unfortunately, there's still so much stigma and discrimination. And here in the Philippines, people still have a lot of misconception around HIV. And so I became curious with that. And so I started getting more involved. And when I won and then I also know that part of Miss Universe's focus, if you win Miss Universe, is to work on HIV and AIDS. Fast forward to after I won, I got introduced to Love Yourself, but by a friend whose name is Tito Boy. I'm sure Filipinos know who he is. I got introduced to the organization, and then that was it. We just clicked right away. So the good thing about Miss Universe, they exposed me to everyone. When I say exposed, like they introduced me to everyone. They introduced me to UNAIDS. They introduced me to GMHC in New York, just so many organizations. And then here in Love Yourself in the Philippines. So that's how it started. And then I got invited to do a few campaigns, and then I learned more along the way. And then fast forward to, it's been 6 years now since I won Miss Universe, and I'm still here. You know, it feels really natural to me because I've learned about it, and I'm still learning about it. And I also have friends who are living with HIV. I lost friends also because of HIV and AIDS, and it's really close to home. So that's why it feels very natural to me to talk about it, even after 6 years after Miss Universe. It doesn't feel like work to me. I'm not an expert. I don't walk around claiming to be the spokesperson, knowing all the answers. Of course not. I'm still learning. I'm still a student. I'm learning along the way, but I'm sharing what I know and using my platform. I'm happy to see that so many beauty queens have followed suit. So many of them are starting to talk. When before here in the Philippines, I mean, I could be wrong, but I didn't really hear much about beauty queens talking about HIV and AIDS. It was always about women empowerment, education, but not so much about HIV and AIDS. And then I was thinking, we should shed light more on these topics. And since beauty pageants are really big in the Philippines, it's a great platform to talk about these things. And hopefully, not just HIV and AIDS, but then also the women empowerment, also about but that's why we're here. We use our platform not just to raise awareness on HIV and AIDS, but also the things that are connected with it, like women empowerment, mental health, domestic abuse, registering to vote. All of these things are connected. So that's how I got into. I was the long story, but that's how I got into it. That's why I'm still here. And hopefully more celebrities, influencers, or beauty queens will follow suit and will become a voice. And I thank you.
And no, we thank you for the work that you do for the communities at risk of HIV. There are a couple more questions I want to ask you, but in the interest of time, I think I want to move on to the last panelist so that he has an opportunity, but we'll come back to you if we have time as well. So this is a question for Dr. Louis Ocampo. Can you share with us, please, the PrEP implementation scale up in the Philippines? One would tend to think that this is probably a PrEP talk. I'm so sorry we're just bringing up issues around PrEP, but it has to do with a lot of PrEP stigma. So can you share with us the PrEP implementation scale up in the Philippines to date, particularly from a CBO perspective, and more so touching once again on stigma-related issues. And this is the reason why I'm trying to bring up. Some of the key barriers to PrEP scale up in my country, Malaysia, have been due to PrEP-related stigma, as I've mentioned before, and concerns around risk compensation amongst PrEP users, particularly at policymaker level. Has this been the same in Philippines, and how has UNAIDS facilitate the scale up, particularly around stigma-related issues?
Thank you, Iskandar. Let me respond to the first question first. PrEP services in the Philippines was started by the community. As discussed in the earlier session, from the initial few hundreds of key populations accessing PrEP during the demonstration study, which was conducted by LoveYourself. And this was done to look at the acceptability of this prevention measure in the local context. The number of new targets has now increased to thousands. And the inclusion of PrEP program in the national HIV strategic plan has been a critical step in ensuring that PrEP services are scaled up from the demonstration project. And to operationalize the strategic plan, the country developed guidelines to ensure correct and standardized approach in the service delivery of PrEP. Initially, PrEP drugs are being supported by Global Fund and PEPFAR. The goal is for the government to procure PrEP drugs to address sustainability. And several development partners, such as the United Nations Program on HIV and AIDS, are also supporting related activities such as demand generation, targeting not only the beneficiaries, but also health providers. As mentioned by Ben earlier, healthcare setting, stigma and discrimination is still prevalent in many countries, and Philippines is not an exception to that. There's also ongoing capacity building activities of service providers, but unfortunately, there are national regulatory mechanisms which need to be completed, before we can fully scale up a PrEP. Local suppliers of the drugs are working hard to get a full product registration from the Food and Drug Administration in the Philippines. And the program is also working on the inclusion of the drug in the National Drug Formulary, which is another requirement for the government to be able to procure using government funds. And these processes are the challenges that we need to hurdle to make PrEP services available in all public health facilities. But while waiting for these regulatory requirements to be complied with, Global Fund and PEPFAR, together with CBO-led facilities and public health facilities, have started scaling up services to enroll more clients. And currently, there are around a dozen of facilities, mostly are CBO-led facilities, who are already providing PrEP, and targeting more people to be on PrEP. Now, you talk about stigma and discrimination around PrEP, and whether this has been also an issue in the country, particularly for the policymakers. Policies and guidelines are vital, to capacitate and guide the implementers of the HIV program. Not only the health providers, but in terms of investment, we need some sort of policies. In the Philippines, we are fortunate because we have a new AIDS law, which was recently enacted to become more responsive to the evolving HIV epidemic in the country. And this new law is anchored in human rights as a core guiding principle, with primary intent to address barriers to access HIV services, including stigma and discrimination. It also emphasized expanding access to evidence-based HIV strategies, and that includes PrEP. Stigma related to PrEP does not exist in a vacuum, and it is produced by social pressures that also stigmatize HIV infection and non-normative sexualities, as mentioned by the other panelists, and limit access to prevention and care services. The challenge now for health is for the health promotion to change the public discourse and to remove that barriers. And recognizing this, UNAIDS supported the development of the National Human Rights Roadmap to eliminate all form of HIV-related stigma and discrimination, including stigma related to PrEP. And another opportunity to scale up PrEP is its integration in the universal healthcare. And again, I would say we're lucky because we have this law enacted recently, and which ensures coverage of all citizens to access health services at all levels of care, including preventative modalities. And that means condom, PrEP, and education. UNH, together with the communities, is advocating for inclusion of PrEP services in the health insurance benefit package. And this is an opportunity for us to scale up and to sustain the services, which now is being funded by external donors. But we want the government to own this intervention and invest on it, because as mentioned, it is discussed in the previous session, the cost efficiency or cost effectiveness of PrEP is way beyond, than the curative aspect of it or HIV treatment. Now, PrEP is an important new strategy that offers HIV negative people a new way to protect themselves from HIV. But while PrEP access needs to be targeted to high-risk population, care needs to be taken so that PrEP is not used, further stigmatized by social marketing campaigns that present PrEP users as responsible, as mentioned by the other panelists, promoting promiscuity, those things. So we need to be worried about the social marketing campaigns. PrEP access needs to be reframed as a positive and responsible option to help people remain HIV negative. Thank you.
Absolutely. We hear you loud and clear about that last message. And thank you very much. I think you've summarized that some of the challenges that have been had with PrEP implementation in the Philippines and the direction that Philippines is heading towards PrEP implementation, and particularly touching on many stigma-related issues with PrEP. Now, I need to, there have been several questions in the chat box. So I'm going to go through some of them at the moment. So this is a question to Ayu. It's from Nitaya Panupak. U equals to U does not equal condomless sex. So I guess some of the discussions that have always been had is that U equals to U is all about not using condoms, but we're not exactly talking about that. So with specifically to Ayu, how do you communicate U equals to U among the people living with HIV communities in Indonesia outside of sex context? So taking sex out of the equation, how do you communicate?
Okay, thank you. It's a very good question. So I think we all know that this UNU concept is, before it's we have the name. It's already, the research is already long ago. I heard about this before it launched. So I think, when it launched in Indonesia, it's going to be something, because the stigma and discrimination, it's very, very scary. I can use that word, especially for not women, but for, the key population. So the stigma, it's not only seeing them as the HIV person, but they also see the background. Who are you? Oh, you are sex worker, drugs user, and then the LGBT group. So right now, what I'm trying to I don't know how I say this, but I always talk to so many people living with HIV every day through my social media. So every time they say anything about the HIV, the highlight issue is, how can I get back to my normal life, or how can I say, the concept of HIV is not scary to my parents, or how can I going back to work? So I think that's very simple. And then I said that, okay, you don't need to explain, but you focus on your treatment. Yeah, you focus on your treatment, I said, and then if you have the good treatment and then you have a healthy life, your body will, increase the good quality, and then you will show the difference when you get the HIV and then after you're taking the ARV. And then at that time you can tell to all the world without explaining. You change, yeah. You show your skin brighter, and then you show that your weight, and then everything is changed because the ARV proof that when you are undetectable, you will get healthier. And then when you put the concept, so you know that if right now we sit together, it will not spread the HIV because blah 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 blah. But even like I have a accident and then my blood going anywhere, it will not make you get the HIV because, and then I think you can use the daily life story and then make them. I always say that if you want to talk about HIV, you should talk about a very in a simple conversation. Do not use a hard sentence or a medical words. So people will feel that, okay, this is also my issue because right now I'm part of the community and the HIV it's also my responsibility. Even you are not have the HIV. I think that's what I'm doing in the community. So I keep asking them to focus on taking the ARV and then make sure the healthy life, and then show, don't tell. But if you need to explain, the concept will prove because you show it with yourself that you're happy and healthy. I think that's all. So it's not only about sexual concept, the you and you. I agree.
Thanks very much, Ayu. And I think just a reminder for healthcare providers to keep that conversation and messaging of U equals to you in very simple. I mean, I often am put in a situation where I have, talked about the evidence behind U equals to you to a patient, and saying there have been 128,000 sexual acts between HIV serodiscordant couples and there was zero linked transmission, only to end the conversation 3 minutes later and the same patient asking me about, well, can I get HIV from hugging someone? And there you have had this whole conversation around something more technical, and you have, and tried to make it simplistic, but forgetting that we often forget to make it even more simpler than that, and address even issues, as you clearly say, like, hugging, sharing utensils. People are more concerned even about that sometimes when it comes to, rather than to having unprotected sex. And of course the messaging around U equals to you in being very clear and concise, that there is zero risk of transmission, not negligible or low risk, but very clear. Okay, we have a question also about related to adherence and U equals to you. I'll answer that separately in the chat box. We also have a question on, this is a question for Maslian. So FPOP's main advocacy is based on adolescent sexual and reproductive health, if I'm not mistaken. How can you support HIV/AIDS advocacy without overlooking your main advocacy? And how far did FPOP go in the advocacy? If we could try and answer that, but also keeping maybe on a stigma-related theme.
All right, thank you for that. So the main advocacy, right, that's right. FPOP's main advocacy is on adolescent sexual and reproductive health. Like what I said earlier, when we talk about HIV, we don't get straight to talking about HIV. We include other topics that are part, or that can be an entry point to HIV, for them to understand that these things are interconnected, and for them to be more accepting of the information and the education that we provide. And then, of course, as a result, they will be more accepting to the services. So for FPOP, aside from doing the comprehensive sexuality education, for now, pre-pandemic, we have been going to communities, educating them, educating the youth with our advocacy. And then after that, we do HIV screening. But for now, since there are restrictions, we have shifted from doing face-to-face into online education. So we do webinars. So we have also our teen talks for us to, for us to really educate them and for us to reduce the stigma regarding HIV and then U equals U. So with Teen Talks, this is a series of talks that are regarding adolescent sexual and reproductive health. We have tackled about PrEP and PEP, HIV 101, and we have also talked about people living with HIV. So we have tried to maximize our reach with that. But aside from that, we also maximize the use of social media platforms. So this is not limited to Facebook and Twitter, Instagram. We also use the dating apps for us to educate the key population. So we use Grindr, Tinder, and other dating apps for us to reach them and for them to be, or for us to take them, or for them to be screened. So because of the limited mobility. So that's basically what we do now, how we have shifted from the pre-pandemic into pandemic. So with our ASRH, or adolescent sexual and reproductive health campaigns, we have actually reached a lot of youth now in the Philippines. So we have now 121 peer educators to educate the communities, especially the youth. We have now 121, and then we have reached around 10,000 people for the 2020, 10,000 young youth, where we have educated them about comprehensive sexuality education and adolescent sexual and reproductive health. So I hope I have answered your questions, Iskandar, unless you have additional questions.
No, I think thank you very much. I think you've answered that. So I think given the time, we're 5 minutes past 4. We're meant to close the session at 10 past 4. I'd just like to summarize some of the discussion topics that we've had. We've talked about the exciting work that the transgender community in Thailand is doing with PrEP in the city, but some of the challenges that they're experiencing with getting forward the index patients to come forward in terms of testing. And we should have this conversation moving forward in order to find solutions to that. We've talked about attitudes and preferences of PrEP, the main challenges, some of the main challenges that have been associated with PrEP rollout within the region. And we should try and at least look into that before we even think about introducing injectables into the region. And it's all down to about choice of PrEP and giving people different choices around various HIV prevention strategies. And training of healthcare workers, and in the very least, to be non-judgmental and to be sensitized around issues of sexual health. Key population-led clinics are a recurring theme. This needs to be scaled up in a big way across the region. Certain countries across the region are leading example. Thailand, Philippines, LoveYourself are doing amazing work with this. And we have no excuse to move this agenda forward by letting the community decide what they want for services that they need. We've had various discussions around U equals to U, and in terms of messaging, who should targeted messaging to, and the continual problems around how people can take U equals to U out of context. And of course, the potential benefits of rolling out PrEP, and certainly not dispelling the personal perspectives from PrEP users in rolling out PrEP. So with that ends our panel discussion. I'd like to thank our panel, Gemma, Dr. Bavington, Vic, Ayu, Marvin, Pia, and Dr. Louis for sharing your experiences with us. I'd like to thank all participants who have asked questions to our speakers. I know there are a number of questions which have been left unanswered. I apologize. I will try and go through them and answer them myself. Or if the panelists have access to those questions, I invite you to answer them as well. We hope you enjoyed the session. We would like to thank the sponsors, Viv Healthcare, Merck Sharp & Dohme, Gilead Sciences, and the Swiss Agency for the Development and Cooperation. Always important to thank the sponsors for their support of this virtual meeting and for making it possible. Before leaving the session, please participate in a poll that will pop up on your screen to help the IS Educational Fund team improve virtual events. So Chris will do his amazing thing now with polls, and you should see it up on your screen any moment now, please. And I think we'll give you 30 seconds to answer that. So did today's virtual session meet your expectations? 59% said definitely, so that's very good. And yes, 41%. So that's, I think, a whopping 100%. So we couldn't get better results than that, can we? Chris, what do you think? Thank you everyone for joining us for today's session of the You Matter, Inspiring a Client-Centered HIV Response in the Philippines and Southeast Asia, by the IS Educational Fund and LoveYourself, Inc. Remember that we do need to understand the issues so we can be united in resolving these issues for the greater community. Let me remind you, this is not the final session. There'll be another 2 sessions tomorrow, so we hope that you'll continue to join us in those sessions. Session 3 will be You Live Healthier with Treatment, and Session 4, You Leverage on HIV Self-Testing. It's been a pleasure. Thank you very much for allowing me to host the session. And once again, I'd like to thank all the panelists in the session. Enjoy the rest of your day. Thank you.